Junior doctors are vital to patient safety, whether it's through ensuring their own safe practice with senior support or whether it's identifying errors and inefficiencies in the systems in which they work. So junior doctors provide new energy, fresh eyes and enthusiasm which has to be fostered and developed so that we can obtain the collaborative and collective changes and improvements that the NHS needs.
About 18 months ago, Naomi Chin, who's a CT1 here, a trainee, sent an email to the medical director, and what she did was suggest to the medical director that we should have a group of junior doctors who concentrated on patient safety. They wanted to learn more about patient safety, they wanted to know how the organisation ran, and she felt that they had a lot to contribute, and as trainees we were missing a bit of an opportunity by not including them in some of our approaches to governance. The medical director was delighted to have this pointed out to him by Naomi and set up a meeting and invited me as Deputy Director of Patient Safety to join the meeting, which I did. She came along, had lots of enthusiasm, had some ideas for getting a group together, and we said we would give full support to that. So the group was established. Naomi chaired the group in the time that she was here. She subsequently has left the organisation and the group has continued to go from strength to strength. And as I say, we're about 18 months on with the group, and it's developing and the organisation's gaining a lot from it.
As a member of the Junior Doctor Patient Safety Improvement Group, it's been a very positive experience. At the beginning of my job here, I didn't know anything on how the trust worked and everything, and this allowed me, gave me a platform to kind of understand how things go on and what were the problems that other junior doctors were facing. So it was kind of a way for me to get on from the beginning, and then from then on it became a forum where doctors could bounce off ideas between each other and also work with other managers and other consultants, which is a valuable experience because it allows junior doctors to discuss their ideas across other doctors as well as vertically across different other positions in the hospital. So that should be capitalized by most junior staff. You don't really get that option a lot in a daily job.
Through this group, we aim to support juniors and enthuse them to take part in different safety and quality improvement projects and have their voice raised and concerns heard through any other trust working groups as well. So they have got the opportunity to take part in, say, critical incident groups, in pharmacy groups.
As part of the Junior Doctor Safety Improvement Group, I've been invited to attend other kind of groups within the hospital. So I attend the VTE committee. They meet on a quarterly basis to discuss issues around anticoagulation and development of protocols and guidelines, reviews of serious incidents involving kind of venous thromboembolisms and things like that.
It's a fantastic way of meeting between the junior doctors in collaborative with other healthcare professionals like IT department, pharmacists, technicians. So it's a fantastic platform for the juniors.
Well, I guess the first meeting I attended, I was quite nervous. I was definitely the most junior member in the group, but I was made to feel very welcome and encouraged to contribute and share my ideas.
They come along to our serious incident meeting, they come along to our hospital infection prevention control meeting, they come along to our patient safety group, they come along to our medicines errors group. These are formal groups that have got very much a committee structure. So we invited one representative to each group from the Junior Doctor Safety Improvement Group. And that's worked really well. We were a bit nervous at first because these people are trainees, haven't had a lot of experience of formal trust meetings, and we just didn't know how it was going to go. Actually, it's brilliant because the enthusiasm that these people bring is marvellous, but also the accuracy of what they bring is the best thing. So where we might think we know what happens in the clinical area, in the reality, when we might be saying, well, this happens or that happens, the junior actually can say, well, yesterday, this is what happened. And when I was speaking to my friend on so-and-so ward, this is what they told me happens. So we actually get some accuracy at the meetings.
From a personal perspective, I'm learning a lot about venous thromboembolisms in general, so the issues like anticoagulation, understanding the indications and consequences of kind of errors there. Also learning a lot about development of new guidelines and the basis behind them and how they kind of come from the very beginnings to finally being implemented. And I think overall learning about the broader experience of how trusts run in terms of the leadership within the committee, investigations into serious incidents that have occurred and things like that.
What the Junior Doctors Safety Improvement Group have been able to point out to us, several things actually they've been able to help us with. But one of the things is about our incident reporting system. So we have an electronic system and we use Datex, as lots of organisations do in the UK. And they've been able to tell us why they as a group don't report, and actually why some medical staff don't report. And it's mainly to do with the setup of the system. And unless you know the organisation really well, some of the mandatory fields make it almost impossible for people to complete the incident report. So very quickly the group were able to say, well, I've tried to report an incident, couldn't complete all the mandatory fields, couldn't report the incident. But also they've been able to point out to us how we can, I suppose, get more accurate information and more valuable information on the incident reporting forms. And again, it's just been a marvellous lesson of how getting a group of young people who are not used to the internal workings of the organisation can look at it with fresh eyes and point out to you some really clear things about how it could work more efficiently. So they've been great on that.
It's particularly important as a junior member of frontline staff to provide feedback to the group about how their interventions are working on the wards. A lot of the members of the committee don't work in the same kind of frontline positions and therefore don't get the true picture of what the changes they're making, actually how they're impacting the staff on the wards. I can identify areas that also need development and feed them back to the committee. And additionally, as being kind of the only junior doctor member, that kind of serves as an important role to disseminate the knowledge to other junior doctors.
So a typical meeting would comprise a lot of factors. First of all, we do a lot of pre-work. So before the meeting, I set up an agenda by meeting with my vice chair and Diane Palmer, who is a deputy director for patient safety in this trust. And then we invite specialty consultant that are doing a lot of work on patient safety to voice their concerns and any updates they have. And obviously it comprises of junior doctors mainly, and we listen to their concerns and the projects we discuss that they want to do to improve patients' quality and safety. And also through this meeting, it's a big networking as well. We get to know other doctors from different specialty, from different trusts in our area. So that's how it compromises off. And usually it happens in the evenings. That gives people time to finish their work and then attend the meeting.
Junior doctors can be a really difficult group to communicate with because they're so busy and they're spread out across the hospitals and trusts. And so what we've been trying to do is gain some feedback about how juniors want to be communicated with, and then trying a few different methods. And I think in the end it relies on using a few different methods to reach everybody. One of the methods we've used recently is a monthly newsletter. So it's a patient safety newsletter. And what we're doing is bringing things like local and national safety issues into the newsletter. We're covering ways that junior doctors can get involved in quality improvements and ways they can get involved in patient safety activities within the trust.
One of the things that we do from that newsletter is that we report on the outcome of incidents that have been reported specifically by the junior doctors. So the juniors can look in that newsletter, and it's not an individual to individual type of report, but they can see that perhaps there've been a series of incidents that were reported and they might have been party to that, and then they can see what actions have been taken.
In the monthly newsletters, the kind of things we're covering are sort of local incidents, so we're picking up on trends, whether that might be medication areas that we're seeing trends in. We're also covering projects that have been carried out by junior doctors, so we ask juniors to write a short summary of their project which gets included in the newsletter. We're also asking allied health professionals to provide their input and insight into patient safety and how junior doctors can get involved. So it's the newsletter is very much made up of a large number of people coming together to produce a single source of information about patient safety.
An example would be when we had some difficulties recently with our bleep system, and some of the junior doctors reported those problems, and then in the Patient Safety Matters newsletter we've said thank you for those who reported the problem, but also these are the things that we've done to improve it and rectify the situation. And we're doing that with some of our medicines errors as well, where they've identified some of the difficulties or even omissions with giving some medicines, and we've then been able to report on some of the quality improvement work that we're doing to try and reduce the incidence of these errors. So it's a great opportunity of using the Junior Doctor newsletter to give them direct feedback.
And to support the newsletter, what we've also been doing more recently is using Twitter. So we're trying to venture into social media. I'm using Twitter to provide some interaction with the junior doctors around patient safety in between the monthly newsletters. And what's, I guess, encouraging about that is the Twitter feed that we're using is gaining some local support as well as national support, and producing some collaborative opportunities, which is exciting.
The difficulties that I have faced is mainly getting everybody together. As you know, junior doctors work really hard and they're basically on the wards all the time. So it's basically to get them on time is difficult. But in that for that reason, we have set up evening meetings, so they're a bit more relaxed and we can chat informally, very casually over a cup of tea and snacks. And I think that's a fantastic way of listening to them and then for them to raise their concerns. And that helps us really well, and we have done a fantastic projects and a few lined up, and we aim to improve that much better and wider.
I've been very supported by the Junior Doctor Patient Safety Group. I had a project with Dr. Wanklin on NG tube placement, and 3 of us with other 2 members and staff, we were able to go to Sweden in Gothenburg for an international conference in healthcare quality and safety, and we were able to be financially supported for this. It wouldn't be possible without the trust support and the group support. Now, further to that, the international conference has been an eye-opening experience. It allowed us all to kind of understand what is happening outside in the world. What are other experts saying about the current problems in healthcare? How can we create innovative solutions to tackle these problems? And I think as junior doctors, we need to expand our knowledge and view about what's going on outside so that we can find better solutions to things and not just always look inward and lack insight in other areas. So I thought the conference was very informative, very inspiring. I heard a lot of great talks, and I highly recommend that. And without the support of the group, we wouldn't have been able to go somewhere this far with the financial costs.
As a group, the Junior Doctor Safety Improvement Group are enthusiasts, young people with lots of energy. And what we find now is that throughout the organisation we get people who make queries and requests for information to that group. So if we wanted to have a system evaluated or to ask an opinion, it's often the Junior Doctor Safety Improvement Group that other managers in the organisation will look to ask their opinion on it, and it works really well, and they're always keen to give an opinion.
It was important for me to be in this group because I care about patient safety. It's all about patient safety that we do. As clinician and also as an NHS team member, I strongly believe that without patient safety, we cannot do anything. So that is the first and foremost reason why I want to get involved. And my goal is to get as much as juniors possible to take part in this. It doesn't have to be just York. I want to spread the news to the rest of the UK and the world that this is a fantastic platform for the juniors to take part.